So hi everyone, I am Angelica Mermicranio and I am going to talk about case study and casework. So let's start with the definition of case study. So according to McKee and Robertson, case study involves a comprehensive and extensive examination of a particular individual, group, or situation over a period of time. So from the word comprehensive, it covers completely and broadly. And extensive, it has to be wide or considerable of extent really. And Young, on the other hand, defined case study as a comprehensive study of a social unit. Good and Skates also define case study as the method which takes accounts of all pertinent aspects of one thing or situation. So in case study, it includes multiple data collection technique, and the data collected are from the multiple sources. It could be from the interviews, observations, questionnaire, and other relevant documents, and also employing as the unit for study an individual, an institution, a community, or any group considered as unit. So case study may also define then as an extensive and intensive investigation. So extensive investigation, it uses a large number of cases to determine the characteristic of a population. And intensive investigation, it examines one or few cases in depth to understand the cause and effects, and both aim to identify the causal factor to some abnormality or deficiency and to find and recommend a solution, a treatment, or developmental procedures. So casework refers especially to the developmental adjustment, remedial, or corrective procedures that appropriately follow diagnosis of the causes of maladjustment or of favorable development. So casework involves direct consideration of the problem, needs, and adjustment of the individual cases, such as a person or family. Case method has been employed to describe a plan of organizing, presenting instructional materials in law, medicine, social work, and even in education, psychology, and sociology. So, case method also defined as the research strategy, an empirical inquiry that investigates phenomenon within its real-life context. So next is case history. Case history is somewhat like the life background of the person that is obtained through interviews, observations, and other means. So with the use of case history, it enables us to better understand the problem of the person and to suggest ways on how to solve it. And according to Woolman, case history includes the complete medical and psychological social history of the patient. Clinical method is a process by which we collect all the available evidence, social, psychological, educational, biographical, and medical, that promises to help us understand an individual child. So in short, clinical method is primarily used to collect detailed information on the behavior problem of maladjusted and deviant cases. So generally, children with some form of abnormalities are subjected to case studies. So those children with exceptional abilities, very high IQ, or children with problems or deficiencies, as well as the social group who also experience some kind of abnormalities and maladjustment, are also subjected to case studies. So for example, those drug addicts, alcoholics, chain smokers, juvenile delinquents, and etc. Kinds of information that is needed in case study. So first is identifying the data. So you first identify the person's name, age, place of birth, date of birth. It has to do with demographic information of the person. So with this, it allows us to better understand the certain background characteristic of an individual. So second is identification and statement of the problem. So are there any symptoms of complaints about his health, schoolwork, his family relationship, abnormal behaviors, work or delinquencies, and etc. Health and developmental history. It has to do with health and developmental issues. So, for example, the details of his birth: is he normal or cesarean? Are there any abnormalities at birth or congenital deficiencies? It also, are the person experience developmental delays, health and psychological issues, or other concerns that may contribute to the person's learning problems. Family history. is the family history has a frequent occurring disorder, like for example, the side of your mother mostly has the diabetes, and the side of your father mostly has various cancer. And in the family history, it includes the attitude of the family. Are there any family pressure, like a pressure in doing such kind of chores at home, or some pressure in do's and don'ts? Also, the relationship of the family. Uh, is there a quarrel between the family? Educational history. So it has to do with educational issues. Like way back in your elementary days, are you having difficulties in reading, writing, or you have difficulties in solving some simple mathematical computation? Do you have low grades, or you shows no interest in schoolworks? Also, your delinquent behavior in school, such as snooping, bullying, stealing, and also your disciplinary behavior that you committed in school. Six is social history. So it has to be the information of people's everyday life, their practices and rituals. Next is the economic history. So it is the human's activity. So therefore we need to know more closely on how people organize their economic status. Are they willingly or grudgingly work even in during chores at home? And lastly, the psychological history. So it has to do with the personality traits of an individual, such as mental ability, special talents, interest, skills, and moods. Are they experiencing some mental abnormalities due to traumatic experiences? So in case study, almost all data gathering devices are used in collecting data. Next is interview is very important. We all know that interview is very important to help us explain, better understand, and explore research subjects, opinions, behavior experiences, and phenomena. So with an interview, questionnaires are usually open-ended questions so that in-depth information will be collected. Observation is also an important tool in case studies because it allows us insight into context, relationship, and behaviors. The questionnaire is another instrument. So questionnaire can be thought as a kind of written interview and often uses both open and closed questions to collect data. So psychological test. It is also administered to the patient for information about this problem. So with the use of psychological tests, we can know or discover the psychological causal factors of the patient. Anecdotal records are also useful. So these are also the results of the observation. So these are the records of significant aspects of the patient's behavior when he finds himself in a different situation and in his unguarded moment. Autobiographies. So autobiographies are rich sources of information about the patient and his problems. So other devices employed are the checklists, scorecards, and rating scales. So also the letters, notes, and diaries of the patients may also help in diagnosing a case. Also the cumulative records in school and guidance, like your disciplinary behavior in school. All pieces of information are carefully and accurately recorded. So statistical procedures are then applied to analyze and organize or summarize the data in which case frequencies, types, trends, uniformities, or patterns of behavior are revealed. This serves as the basis for resolving the problem or conflict. This is interpreting the evidence available.